I'm Dr. Tarryn Jacobs. I'm a specialist dermatologist, and I'll be sharing a few tips on acne today. Acne is a condition of the hair follicle and the associated oil gland, which becomes blocked and inflamed. There are several different factors that cause acne. Our skin is constantly shedding dead skin cells, and the trouble begins when this process slows down and there's increased skin cell stickiness, which leads to blocked pores. At the same time, there's an increase in oil production, and this is mediated by hormones, and this leads to pore occlusion too. We also see an overgrowth of bacteria called P. acnes, which contributes to inflammation and pimples. Acne can appear on the skin in a number of different ways. Blackheads and whiteheads are small bumps on the skin, and these are known as comedones. If acne becomes inflamed, then it can appear as red bumps, pustules, or deeper bumps called nodules and cysts. What many people don't know is that for every visible lesion of acne on the skin, there are many microcomedones underneath the skin which are not visible to the naked eye, and this is actually the first stage of acne. So the most important thing is to cleanse your skin morning and evening. The purpose of cleansing is to remove the dirt and bacteria and oil. Be careful not to over-cleanse because this can lead to rebound oiliness. There is a myth that people with oily or acne-prone skin do not need to moisturize. The truth is that oil content and water content in the skin are different things. And so oily, acne-prone skin still needs a moisturizer. The next thing you need is a good sunscreen. This is an important part of any skincare routine. It can also help prevent the dark marks that are left behind from spots from darkening. Getting ahead of acne means preventing new spots from forming, and this means keeping pores unclogged. Recently, a new plant-derived ingredient called comedoclastin has been shown in studies to prevent the transformation of the invisible microcomedone. It has also been shown that it can limit the appearance of new acne lesions. I'm often asked about the role of diet in acne, and this has been controversial through the years. Emerging research has shown that foods that are high in glycemic index and possibly some dairy may exacerbate acne in a minority of people. The way I would translate this, however, is not to cut out sugar completely, but to limit its consumption. This is good not only for our skin, but for our general health as well. When it comes to makeup, there's no need to avoid this if you have acne. Choose your makeup carefully, opt for formulations that are oil-free, non-comedogenic, meaning won't clog pores, and light in texture. Always remember to wash your brushes and applicators every week to prevent the transfer of bacteria to your skin, which can cause new breakouts. My next tip would be to try and manage your stress. The oil production in the skin can be influenced by certain stress hormones. Stress relief is not easy, so we all need to find out what works for us individually. Always wash your skin post-workout. You want to remove the oil and sweat and bacteria from the skin that can promote new breakouts. I always recommend going makeup-free when you're working out. And my last piece of advice, as tempting as it may be, avoid picking and squeezing your pimples. This can actually lead to secondary infection and scarring.